In this video, I'll be talking about the 3 action principles of psychological first aid: look, listen, and link. The first action principle of look involves a number of different actions. The first one is to gather information about what has happened and is happening. If you're in a situation with many people, you need to find out who needs help. The next action is to explore safety and security risks. If anyone is unsafe, you need to address that first before going on with other PFA actions. After you've made sure that you and a person in distress are safe, next thing to check for are physical injuries. If you encounter someone who has physical injuries, tend to them first before going on with other help. Another action is to assess immediate and practical needs. Find out what the person in distress needs help with right now and here. And last, it's important to recognize what reactions the person is having to assess whether these are what we call common reactions or whether the person is displaying severe reactions. Some examples of common reactions to distress include physical reactions, such as shaking, sweating. Some people have stomach problems and feel nauseous. Some people have problems sleeping. Others feel an increased heart rate when they're in distress. Some people have difficulty breathing. And sometimes people feel they have no energy at all. Examples of behavioral symptoms of distress include withdrawal and isolation from other people, crying or screaming. Some people laugh when they're in distress. Others find it difficult to move, especially if they feel shock, while others find it difficult to keep still and may pace and walk around and not want to sit down. Sometimes people overeat or don't eat at all when they're in distress, and some people may show aggressive behavior if they're feeling a lot of anger. Another behavioral sign of distress is increased smoking or alcohol or drug use. Examples of emotional reactions are feeling shock, feeling fear, feeling anger or sadness, feeling anxiety, or not feeling any emotions at all. Some people also experience mood swings. They feel happy one moment and sad the next moment. And last, you may also feel quick irritation. Cognitive symptoms of distress refer to what happens in our mind. So, common cognitive symptoms of distress include poor concentration, feeling confused, having disorganized thoughts, perhaps forgetting things quickly, finding it difficult to make decisions, having dreams or nightmares, or what we call intrusive or involuntary thoughts. And last, there are also sometimes spiritual symptoms of distress. That includes perhaps feeling a sense of emptiness, perhaps feeling discouraged or losing hope, and generally just feeling negative about life. Some people may also doubt their faith, or feel anger at God, or perhaps feel a sense of alienation from other people, or a loss of connection from other people. It's important to remember that common reactions to distress are what we call normal reactions to abnormal events. However, you need to also recognize when someone is having a more severe reaction, because then you may need to make a referral and ensure the person gets more specialized help. Examples of severe reactions include if someone has been unable to sleep for many days and starts to feel confused or disorientated. Another severe reaction is if someone is unable to function normally and care for themselves or their family. So, for example, they stop practicing hygiene or cooking or eating. Another example of a severe reaction is when someone loses control over their behavior and they perhaps become unpredictable or destructive. Another severe reaction is if someone threatens to harm themselves or to harm others, or if someone starts excessive and out of the ordinary use of drugs or alcohol. If you meet someone who's in distress that has a chronic health condition that needs specialized support, you also need to refer them for immediate help elsewhere, or if they present symptoms of a mental health condition. Now I'm going to tell you a bit about the actions of the action principle listen. So, listening is more than hearing. Hearing is what we do with our ears, whereas listening is what we do with our entire body and being when we encounter another person. So, listen starts with how you introduce yourself. When you encounter someone in distress, it's calming for them that you introduce yourself in a good way and explain who you are and that you're there to help. It's also important to pay attention to the other person and listen actively. Active listening can be shown in both verbal and non-verbal ways. Verbal ways of showing that you're listening are sometimes repeating what the other person has said and checking for understanding, or saying, or I understand what you're saying. Non-verbal methods of showing that you're listening include facing the other person directly, having an open body posture, nodding when they talk, keeping eye contact. It also involves calming someone. There are many different methods you can use to calm someone in distress. A common one is to guide them through a breathing activity, where you ask them to follow your breath and take a few deep breaths with you so they can feel calm and centered and able to manage their situation. Listening also involves asking good questions. So asking questions for clarification, asking questions about the person's needs and concerns in this immediate moment. In that way, you can help someone to find solutions to their problems. The last action principle of link refers to helping the person in distress access information. When you go into a situation where you know you'll be providing PFA, it's good to anticipate what kinds of reactions you think people may have and come prepared with psychoeducation material. Psychoeducation helps a person understand the reactions they're having and can also give some tips on how they can manage their situation. Link also refers to connecting someone in distress with loved ones and social support. So, be prepared to maybe lend someone your telephone so they can call their loved ones. Link also refers to tackling practical problems. Earlier we talked about asking questions about needs and concerns. Link refers to thinking more about how to tackle the different problems and then guiding the person into getting more help elsewhere. So the last part of Link refers to accessing services and other help from other people or institutions, and it can be informal help or formal help. It all depends on what the individual person needs. It can sometimes feel difficult to help someone who's in distress. Therefore, it's important for you as a helper to always practice self-care. When you've learned the different action principles, look, listen, and link, you can apply these to yourself also. You can look and recognize your own symptoms of distress. For some people, that means perhaps they start snapping at their family or not coping in the way that they usually do. And when you recognize your own signs and symptoms of distress, it's important that you listen to yourself and start thinking about the action of link. So if you're very stressed and you recognize that you're not handling things the way that you want to, stop, listen to yourself, and think about what you need to manage your situation better. There are also multiple ways that you can practice self-care. One way is to focus on simple and routine tasks if you feel overwhelmed. Another important method is, of course, peer support. Talk to friends or colleagues about how you're feeling. Also, remember to do exercise, rest and sleep well, eat and drink healthy, and avoid overuse of alcohol or substances. Do things that you enjoy and ask for help when you need it. You can learn more about PFA by downloading our guide on PFA from our website, and there are a number of different training materials you can use.